Hey there, I'm Dr. Anthony Claude. I'm a board certified psychiatrist. In this video, I'm going to answer a question about whether or not psychiatric medications can be stopped or not. So one of my viewers recently asked, has anyone successfully stopped this medication and recovered? And they're particularly asking about olanzapine, although there are general rules that can apply to all types of psychiatric or mental health medications. And so, of course, each person is unique, and the reasons they are on these medications they need to talk to with their prescribing doctor. But I'll talk about my general rule of thumb of how I go through this reasoning process. Because this is a common question that gets asked, or if it doesn't get asked, it is something that's important to know. For example, how long does someone need to be on the medications? Are they safe to stop it at some point in their life? Will the symptoms come back if they do stop it? Do they really need to be on it to begin with? So again, each case is unique and needs to be talked about with the prescribing doctor. But my approach often starts with what was going on at the time when someone was put on these medications. Was there a lot of stress in their life? Like, were they going through relationship stuff? Were they under stress from school? Were they just laid off from the work unknowingly, and it caused a lot of financial stress on them and the family? So a lot of these things can put someone over the top to where they get mental health distress or have these episodes. Or were they using some sort of illegal drug at the time that was causing it? And yes, even cannabis can cause a lot of mental health problems. So THC in particular, were they using any THC, alcohol, methamphetamines? Were they going through a period where they weren't sleeping very well, like maybe not sleeping enough, and that caused them to have mental health problems? So there's a lot of factors taking a role. Were they going through any medical conditions that caused them to go through some mental health struggles or challenges at the time? Also, a common question I'll consider is there any family history of mental health problems such as like what one is going through? Because typically if there's a family history of it, that'll make it more likely that other members of the family will go through these episodes. So I would take that into consideration about maybe being on the medication or the treatment more longer term if necessary. And again, as a general rule of thumb, assuming there wasn't any specific stressful events or factors that led to people being in these episodes, if it just sort of happened out of the blue, then these episodes often will happen in the future. And if not treated, for example, even if someone's feeling better and their symptoms are all gone, oftentimes it's recommended to stay on the medication for preventative measures, especially if one is not having any major side effects to it. Because typically episodes can happen further down the road. They're more likely to happen down the road, and they can tend to be more intense and last longer if they've already happened in someone's life. And so being on the medications and treatment can help protect that from happening in the future. However, if someone goes through an episode at some point in their life and maybe they're on the medications, they talk about it in therapy, they learn strategies or coping skills that help them with stress management or to deal with some of these stuff, or maybe they find out that they were using some sort of illegal drug that was causing this and they stopped using that drug, then maybe they don't need to be on these medications if their symptoms have been, say, resolved for the past 6 months or past year or so. Again, it's a very delicate situation because each person's life is unique, and it's something that should be talked about with a prescribing doctor. And one of the things is always taking into account whether the benefits of the medications outweigh the risks. So be sure to communicate that with your doctor and have that open discussion and communication, especially if there are strong side effects, which, for example, olanzapine or some of the medications cause weight gain, so people don't want to take it. Those are something to consider as well. Thank you for watching. Hopefully this helped to answer your question. Be sure to subscribe to the channel to help support the channel and like the video for more videos like this one.